The second major area is we obviously have not neglected our old housing estates. In fact, most of our estates are older, by its nature, because this is the older part of Singapore. And we have always been constantly trying to refresh them, give them a facelift. And that's why all the MUP, LUP that you have heard in the past. So the way going forward is there will be many more HIP and NRP, Home Improvement Program, Neighborhood Renewal Program. HIP, we have counted in our GRC how many blocks will be eligible. More than 150 blocks. So there's a lot of blocks. And we need to space them out. We will start out with 13 blocks, 1-3, in Marsiling, because Marsiling is the older part of our GRC. Who are they? Blocks 1, 2, 3, all the way to block 131. So all those 13 blocks will enjoy HIP, Home Improvement Programs, and to be followed by the remaining of the 150 blocks over the next few years. For NRP, Neighborhood Renewal Program, how many blocks are eligible? 168 old blocks stand to benefit. 一路發啊，幾好啊。So 168 blocks will stand to benefit. This is a very good program. Residents do not have to pay a single cent. All fully paid for by the government. And it will improve your external areas, the neighborhood estates. We were kicked off with quite a large cohort, 65 blocks for NRP, 65 blocks in Marsiling. Who are they? Blocks 101 all the way to block 143. Yeah. So these 65 blocks will be the first batch to be followed by the other 100 blocks over the next few years. And of course, we are coming to the tail end of LUP, Lifts Upgrading Program. I've completed that for Sembawang Division and Marsiling. We still have a few outstanding blocks. All the eligible blocks for LUP, we will conclude them within this five-year term. They are highly popular, and we will wrap them up. I know they are eagerly looked forward to. A few blocks are in my division in Marsiling, but most of them are in SBS, Hawazit IP's Marsiling division. The third aspect is to enhance outdoor life. I've asked many of you, why do you choose the north to live, to buy flats here? They say, oh, open, green spaces, blue sky, plenty of trees, areas where you can fly kites, with your kids. Your kids can run around safely. And those are indeed some of the important assets of living in the north. And we have always been focusing on that area to enhance them even more. So Admiralty Park, waterfront, I've talked about that. And I mentioned Sembawang Park, a very old, popular park, and remained very popular. Yesterday I was there in the afternoon, and it was just crowded. It was crowded by all sorts of activities enjoyed by Chinese, Malays, Indians. 70-80% people in the north to be expected. But 10-20% comes from further afield. I met one family who went there fishing from Bedok. I met another family who has relatives visiting them from Bangladesh. The children are Singaporeans, but they have relatives visiting them, and they brought them to Sembawang Park. So we will definitely keep the old world charm, but I think there is scope to upgrade it, to improve it. So upgrading Sembawang Park is within our 5-year plan. What can be done? I think you can see glimpses of that in the exhibition. We thought the beach front of Sembawang Park very popular. We can extend that so that it looks, the beach areas look natural and even bigger. And of course, barbecue is always very popular. As I walk around, many of them invite them to join them to eat their barbecue. I have to tell them I'm vegetarian now, so thank you, terima kasih. but they were extremely warm, and I'm very grateful to them. And of course, many more cycling tracks. We are not through yet. We have built 26 kilometers, and many more kilometers will be built. We can't build it everywhere, but where they are heavily utilized, we will. Waterfront, Woodlands waterfront, I mentioned it, it is really a very big hit among residents. Fourthly, we are away from the city and yet not that far away from the city. But we will improve further connectivity. We have MRT, we have bus connections, but it can still be enhanced. I know many of you have told me that MRT trains are very crowded, so I know MOT is working very hard to try to add more trains, and that will improve the situation. But longer term or medium term, many more MRT lines nationwide will help solve this fundamental problem. And in our case, what is coming, Thomson MRT line, and not just MRT, but also expressway, so North-South Expressway. They cannot be completed within the next 5 years, but within the next 2 terms, so by 2020 definitely. But much of the work will begin during the next 5-year term. Finally, I thought as Health Minister I should cover a little bit on healthcare and what will healthcare in the North. And you know about the Khoo Teck Puat Hospital, which I mentioned about, but we are doing more than that. A new community hospital in Yusun, next to the Khoo Teck Puat Hospital, is being planned and will come about within the next 5-year term. And it's not just community hospital, but also nursing homes. And specifically for the North, 2 brand new nursing homes will be built. They will replace 2 very old nursing homes which are wrongly sited in the wrong place. Villa Francis, which is tucked away, very far away, very inaccessible, and one more nursing home which are far away. So we are bringing them straight right into HDB estates, which I think will be popular with the residents. Easier for them to visit their parents or grandparents when they need to be institutionalized in the nursing homes. But it's more. I'm studying because you see in Jurong we try a pilot which I call Jurong Medical Center. Jurong Medical Center brings specialist outpatient care and day surgeries right into HDB towns. We tried that in Jurong so that patients who require, let's say, minor surgeries or cataract operations or LASIK or whatever, you do not have to go all the way to Singapore General Hospital or National University Hospital. We bring the specialists out into the housing estates, and we design such day surgery centers in a very conducive manner with full glass windows, so as you recover after your surgery for a couple of hours, you can look out into HDB blocks and perhaps into your own flat. That kind of things, and it's become extremely popular. And because the overhead there is cheaper, the cost is also slightly cheaper than if you go to SNEC or to SGH or NUH. So I consider that pilot highly successful. I'm going to do a couple more. And one of them, I hope, will be in Woodlands. So Woodlands Medical Center is something that I'm looking at, and I think there's high chance that we will do it within the next 5 years. But, thank you. So I think together with polyclinics, medical center, outpatient day surgery centers, a very good general hospital nearby, and nursing homes, and our improve on home care, I think we would have complete the picture of the full spectrum of community health care for Singaporeans. But more than health care, I think community bonding is extremely important. The one thing I like a lot about residents in Sembawang GRC is the very strong community spirit. Many of the residents here, they were living in the kampongs in the north. And when on-block redevelopment, instead of being dispersed throughout Singapore, most of them, 80-90% of them, were relocated in HDB estates. And they kept up with that kampong spirit and that bonding, which is extremely heartwarming. And we have gone into second generation now, and I'm always very cheered when I heard from them saying the children are buying HDB flats nearby, enjoying some of the benefits that HDB provided if you are near to your parents, so that extended families are now around in the vicinity in the north. And that further consolidate this kampung spirit, which I think we must continue to build on. So all our CCs are very, very active, and I must thank all our grassroots leaders for their passion, and dedication in keeping the CCs active, buzzy, and also moving with the time. So these are no longer activities of 20, 30 years ago, but old activities which are popular are retained, new activities are being added all the time. And of course, as population grow, we are adding new CCs. So within the next 5-year frame, at least 2 new CCs will be built, one in Woodlands and one in Admiralty. So Woodlands will have 2 CCs. And this will be very modern CC, which all of us can be extremely proud of. And I think they will bring in even more residents and more community activities.